Give it a shot. Okay. All right. Oh, it is. Margot looks like this. Okay, great. Oh, is this you? This is me. Sure. My computer? Okay. Yeah, right. This is me. You're right. Oh.
We're still setting up here.
Just a
second. I don't see you. You've got chairs pulled up back. What discipline or where are you on campus? Okay. And you? I'm in nutrition, exercise physiology. Okay. Business specialist. Oh, okay. Okay. Campus. No. Go, bro, right? Yeah. I used to work for the state. Okay. Yeah. Oh, great. Yeah.
Come get cozy. Okay. Are we on here? I dialed in. Okay. Yeah. So we should be good. Yeah.
Come on in. There's still chairs here. We can move some more up.
Margot's in here. Hi, Margot.
Okay.
Hey, Jamie, how are you doing?
Good, good. Thank you for chiming in. We just wanted to make sure you could hear us on the phone.
Yep, I can hear you just fine.
Great, thank you.
Yep.
So it's 10. You want to wait a couple more minutes in case anyone else shows up? We got a pretty full room here,
Yeah,
though.
I think this is most of our group.
Okay.
So, yeah.
All right. Well, welcome everyone. Thank you all for being here today. We're here to talk about all things Missouri. Some of you may be more familiar than others with just what that means. So real quickly, I'll describe kind of the flow of what we'll be talking about today. I thought we'd do some introductions first, with a lot of new faces around the table, and some of you probably don't know any of us here at CARES. So we'll do some introductions, then we'll move on to a short PowerPoint to kind of give a background of this All Things Missouri project, and talk about the health and safety impact teams and what kind of that means to be part of this team here. And then we're going to do a demonstration of the current All Things Missouri website. And after that demo, we'll begin our discussion around data to support work in health and safety, as well as kind of data gaps. And then we'll kind of close with some next steps, some discussion points for our next meeting. So with that, let's go ahead and do some introductions. We'll kind of keep this pretty brief since we have a big crowd around the table here. I'll start. My name is Angela Johnson. I am the Senior Research Project Analyst here at CARES, the Center for Applied Research and Engagement Systems. A lot of my work is around health data. So I support a couple of our projects with community health needs assessments, and I work on the All Things Missouri portal, as well as the MU engagement portal, just to name a couple of things, but do a lot of work with health data mapping and data analysis. So this way.
Sure. Jamie Kleinsberg, I'm a project director here at CARES, and I'm also leading the business and community impact team, which we will be hosting this afternoon from 2 to 4. So we're going to be doing a repeat of this with a little bit different context. So.
Jenny, I'm newcomer to CARES. I work closely with Melissa in improving the usability of our platform.
My name is Michael Hardy. I am the second Senior Research Project Analyst.
I think we should dispense with titles because HR has such weird titles.
Well, they changed our title not long ago. It's 4 words and they all come together in different combinations. So I'm just happy to get through that part. But so I'm actually leading up the youth and family section of the ATM site. So
name is Chris Barnett. I'm the Assistant Director here at CARES, and I am leading up the Ag Environment Impact Team for the All Things Missouri website. I've worked on a variety of projects here at CARES.
Hi, I'm Dale Fitch. I don't work for CARES. But I do care about CARES. My day job, I'm the Director of School Social Work.
And I'm Kathy Bowman, and I work for the School of Nursing and University Outreach. And to be working with Health Extension. I'm Melissa DeBart-Talomeo. I'm part of CARES. I'm a programmer and usability specialist. So with regards to this project, my jobs are with Genting to help make the All Things Missouri platform more usable. So, you know, if there's a prominent button that really needs to be clicked to generate a report, and people can't find it, it's our job to help figure out where that should go. And also to really to listen to you all and to your compatriots in Extension and understand better what resources and tools we can provide or we can help integrate with how you all work, the technology you're currently using. Yeah, so I'm here to listen, and today I'm just here to take notes, thankfully.
I'm Sarah Wood. I'm with Extension, nutrition specialist, registered dietitian. I'm in the Northwest region.
My name is Wilson Majay. I'm a faculty in health sciences and public health from Missouri Extension Community Development Specialist.
I'm Steve Ball. I'm a professor in nutrition, exercise physiology, and state fitness specialist with Extension.
I'm Erin Magruder. I'm the curriculum specialist for Extension Fire and Rescue Training Institute.
Good morning. My name is Chris Fulcher. I serve as the Director of CARES, and I just can't underscore enough how important this is. Bringing you all together and the other three impact teams is really a much different approach of what we've done before. And just building websites and throwing stuff out there, this is really being intentional, building it with you, getting your input so we get this right. And I know from the user experience folks, this is so very important. So I really look forward to hearing, you know, what comes out of all these meetings that we have. And I believe we have someone on the phone.
Yeah.
Right? Someone on the phone, if you could, brief introduction.
Hi, everyone. I'm Margot Myers, Nutrition Health Education Specialist up here in Kirksville, Missouri, in the Northeast region.
Great.
I'm Dr. Bilalisa Aida. I work with the Center for Continuing Medical Education, the School of Medicine. So working with, I'm part of the team with Chris, and we currently working on the opioid pilot project. So they invited me to the meeting. Thanks for having me. Thank you.
And we just are wrapping up introductions. So if you wanted to briefly.
I'm Linnell Phillips. I have worked for the State Health Department in Missouri for a number of years, and now I'm faculty on campus at School of Health Professions, and also had lots of school of nursing. So.
All right, well, that is everybody. So I do want to mention that we're going to keep this whole conversation it's going to be a pretty informal thing. So if you feel if you need to get up, grab snacks, there's bagels, fruit, coffee. Welcome to do that anytime. There are restrooms, women's restrooms are that way, men's are
Up or down.
up or down. So yeah, feel free to get up anytime, and feel free to ask questions anytime too. So this is going to be probably a lot of new information for a lot of folks. If you have questions, why are we doing this whole thing? What's this? What are you talking about? What's that acronym? We do a lot of acronyms at CARES, and I'll try to do my best to not to spell those out where possible. But if you have questions, just interrupt us at any time. Okay, well, with that, we're going to go into our kind of quick background PowerPoint here. So what is All Things Missouri? Who is CARES? What are we doing with All Things Missouri? And what do we hope to get out of this endeavor? So let's see. Okay, so what is All Things Missouri? All Things Missouri is a website. It is a site that we're hoping will support the work of faculty, staff, and leaders at the University of Missouri. So we have data resources, reports, tools that we hope will be useful to folks in various fields. So our primary audience at this point, we're hoping will be the faculty, staff, and leaders at University of Missouri. Our second use case, and we'll go into some of these a little later, are legislators, public officials, leaders, and community organizers across the state. So how are we serving these audiences? Primarily through mapping and reporting tools, and by providing access to data to help facilitate and make better data-driven or data-informed decisions in local communities. So why are we doing All Things Missouri? What's the purpose of all this? So All Things Missouri was somewhat initially funded in part to provide some continuity for a project that we worked on with MU Extension at the quantitative needs assessment. There were several arms of this needs assessment. There was quantitative, where we looked at data around issues in the state, a qualitative, where folks went out into communities and collected conversations, as well as like an internal assessment of programs. So what we did with that effort was looked at issues, put data around issues, and this All Things Missouri platform is a way to kind of continue living that on. But beyond that, the expanded vision of All Things Missouri is to take those issues, take the data around those issues and tools, and give them to folks as a tool to help them better understand issues across the state in local communities. So things like the opioid crisis, when that hit, and we don't know data about how it's affecting our local community, we can go in with hopefully the tools on All Things Missouri and get a sense of what the data is actually telling us about that. So the site, All Things Missouri, initially launched in May, and in May it was basically a collection of many of our existing tools, as well as a new one new tool called the, what did we call that tool?
The
crosswalk tool, community crosswalk tool, where was developed more specifically with the legislature in mind. But the process of All Things Missouri, our intention is to build it out through some rapid prototyping. So, and to that end, that's why we're hosting these design sessions now. So we'll have design sessions through November, December, the end of this year, and based on the feedback that you all give us and through these other 3 impact teams, we'll be iterating that feedback and applying it to the platform across 2019. Yes, please.
Angela did say that we could ask questions and comment.
Yeah.
For me.
Anyone from our team has.
I think what's so important, we spend a lot of time picking and having extension leadership also put names on who's on each team, because there are different audiences internally. For field faculty, extension field faculty, really thinking about this with your lens in mind in terms of what you need, in terms of what you're doing in counties and across regions. Dale, you and I have been talking for over a year in terms of how we work with data, provide data from a research perspective. So really come to the table with that hat in mind, because this is really going to try to serve multiple audiences internally and also push out what we make publicly available. So I just wanted to
thank you.
Double click on
The Zoom presentation is not keeping up here. Does that work? No? Okay, well, we'll just go back to this mode for now. So that's a little bit of the history and about for All Things Missouri. So why is CARES involved? Who is CARES? Who are CARES? Who are we, the team at CARES, and why are we involved in the process? So CARES was selected as a partner with All Things Missouri, partially because we mentioned our work with the needs assessment, but we've actually had a long history both with extension and with data and data visualization. So we've had projects across all 4 of Extension's impact areas: agriculture, environment, health and safety, business and community, youth and family. And we actually recently moved into the umbrella of Extension as an official partner or center within Extension. So some of the tools that CARES has helped develop might be familiar to some of you. I've listed a couple up here: the AgSite tool, the SNAP Ed assessment tool. CIM, Community Issues Management, was an older version of our tools that I know some Extension folks used. The Show Me Select Replacement Heifer program for those working in agriculture. The MU Impact Portal. This is the engagement portal where folks were entering their work across the state. I mentioned some of our community health needs assessment work, and the list goes on. Yeah.
And one thing that CARES was founded in 1992, and interestingly enough, most of our work has been outside the state of Missouri historically, working with major foundations like RWJF, Kellogg Foundation, with federal agencies. So we've developed a number of tools and applications, and it's a great set of expertise at CARES that really is grounded in a lot of tools that have been built out elsewhere. So with the move to Extension, we're really being laser focused on Missouri. Let's take what we've learned, let's take what we build and apply it in a real intentional way for this effort here.
Right. So why are you all here? What are these impact teams? So there are 4 groups of impact teams, 1 team for each of the 4 impact areas: health and safety, agriculture and environment, business and community, and youth and family. And the purpose I kind of alluded to was to kind of help us iterate the All Things Missouri platform. So we've got the site. It launched in May. We'll show you that in a few minutes here. And we're hoping to have, these informal conversations, discussions about what your needs are, what your data needs are, what you could see using the platform for, to help us further build out that platform. So we're scheduled to meet 3 times, but we also might, send you some email communications, some surveys. We have our user experience team to do some user testing, and the teams where Chris mentioned were the names that we selected. You all here were given to us through Extension leadership primarily, and we tried to get some representation across campus, field faculty and staff, state specialists, as well as regional directors, and all of those folks will be contributing to these design sessions over the next few weeks and months. So again, what's the purpose of the impact team? So we're hoping to make the site, design the site, build the site with you all in mind. It's not a tool that you're going to be, mandated to use in any way, but it is a tool that we hope you will use, and we hope you'll find helpful. And the more input that you give us, the more helpful that tool could be for you all. So to reiterate what's on the slide here, we are not experts in what you all do. So we don't know what data, what tools you would like to have or need to help you do what you do. So that's the purpose of having these conversations. It's kind of a mutual learning experience. So we're hoping that, through the data, through the tools, we can help you be innovative. And maybe it's a data set or a tool that we've never heard of that you all use every day that we could help make better. So we want to help you access the data, make data more accessible. That's a lot of what we do to make these better decisions. And at any time, whether it's during this meeting, through an email, we want to hear your ideas, suggestions, and any feedback you have, so we can help build this thing together.
And with that, CARES for many years has made thousands of data layers publicly available and just kind of throwing it to the wind. What can we do as a university to be more intentional about what data we have secure? It may be a public data set, but we have it part of Extension, part of research, and what is our value add as a university? So in some ways, it's going to the table with data that may not be publicly available. That's part of the process deciding. What is that value add? Also, revenue generating opportunities that has been talked about around campus quite a bit. So I just wanted to add that.
No, thank you. So beyond just having, what are the goals of, what do we hope to get out of this today? Through having these discussions, but we're also hoping to share with you the All Things Missouri platform. Some of you may be familiar with it, some of you it may be the first time you're hearing about it. So we'll kind of do a demonstration to walk through the site design, go through some of the tools in detail, look at the data list and some of the external resources, and we'll then talk about the different ways that, just have a little kind of small focus group discussion about how you think All Things Missouri might be able to help you do some of what you do, or how you could see it applied to various work. Maybe it's not your work, but other work that campus folks do. And then we specifically want to talk about data. So are there data sets, public data sets, or maybe primary collected data sets that we could have in that platform that would make our tools more robust as they are now? And then we definitely want to open up any opportunity for questions.
And regarding data, again, a lot of our data is national secondary source data.
Mm-hmm.
What's unique about All Things Missouri and what we learn together here in Missouri can be adapted and will be adapted for the other states around the country,
right,
is what state level data. Think state level data that doesn't get aggregated nationally. That's the value add, is if we can think also about state level data or local or regional data, and working on like the opioid crisis, is that we start drilling down, and that again is also a differential that we need to be thinking through.
Mm-hmm. So that's the first session. A brief preview of what we'll do next month. It will be a really robust discussion about that data list. So beyond just today, we're hoping to give you a brief kind of homework assignment where you can think about what state level data or local data would have a best impact on your work. So we'll talk through that in detail, and then we'll also kind of bring that discussion into other tools and resources beyond our current, mapping and reporting interfaces that might be helpful and useful. And then we're going to have, after you're very, very familiar, maybe too familiar with All Things Missouri, go through a kind of a user experience process guided by Melissa and Shenting here. And also kind of more talk in detail about other technology tools that you all currently use and what you like about those tools, what you don't like, and if there's any application for those types of tools on All Things Missouri. So that is the overview. I will pause there for any questions from the team. Yeah.
So is my extension going away? I mean, will this replace that? No, okay.
So that's a good question. No.
Okay.
This is a completely separate process, and my extension is much more around inputs, reporting requirements, etc. This is really no.
Okay. So
we could go into a long discussion.
Yes, we could.
But no.
We don't want to open that.
No.
Yeah.
Well, I'm just thinking, my extension, I know Sarah and Margo, we work on a program called Stay Strong, Stay Healthy. It generates lots of data. That program or platform doesn't generate what we need.
Right.
We actually have to go in and hand enter data after research faculty are inputting this information. We're putting it in our own Excel spreadsheet and generating our own reports. This could be exciting to us if we could say, okay, here's what happened in the Northwest region in the last 5 years with Stay Strong, Stay Healthy.
Right.
Here's what happened statewide. Here's what happened in other states where we're implementing the program. Right now, we have to generate those reports ourselves. So I'm just trying to.
Yeah, and that's exactly the kind of thing.
Report into my extension.
I think we definitely want to hear that exact type of need. So if that's a big pain point for you all, you've got this great data, and there's no automated way or standardized way even of reporting that, and that's definitely something we want to hear. So 2019 is really wide open in terms of what we build out for All Things Missouri. I think we have some goals in mind, especially with one of the objectives is to take the All Things Missouri model and sell that to other states. So that's something that that Marshall Stewart has been talking about doing, and we're not quite ready necessarily to go there yet, which is why we're doing this process now. But Yeah.
It's really important. My extension, we Don't Touch John and their team, been doing it for years. We're coming in with this framing here. One thing we do know is primary data collection is going to be essential.
And evaluation.
But yes, and so we got to live this out together. How do we complement what my extension continues to do in some ways? How do we help facilitate, make things easier through this? Adding primary data is going to be so important. Location of, where fresh fruits and vegetables or grocery stores are just something that there's no statewide database. I see field faculty, county engagement specialists, et cetera, playing a very important role of taking the pulse and making it available in a meaningful way here. So just wanted to tread lightly on this versus my extension, but really work with leadership in helping them understand that.
Right.
And yes, Dale.
So I think the relationship is that the CARES database is the denominator, and then all projects are the numerator. So then it gets back to my question was around the taxonomy. So if you set up a project, are your variables aligned with the CARES variables?
Right.
So is there a taxonomy that's been established? Because that's what the researchers are going to want to know, because otherwise they'll be keystroking or paying somebody to keystroke data.
Yeah, and we'll go into the engagement portal as part of this demonstration today. That's one of the All Things Missouri tools and resources that we can talk about, and I think that's kind of what both of you all are specifically alluding to. So, yeah.
So I was thinking ahead to the social determinants of health. So
right.
That, I mean they have a robust taxonomy, so no need. So if it can map on, that would help researchers at the time.
Yeah.
I think that's so, and this is why it's a great blend between researchers and then field faculty, et cetera, is taxonomy is going to be really key, because what I've heard before we moved to extension is that extension in many ways there was over-reporting, or there was so much stuff and it went into a black hole, right? And we want to lift that out so there's immediate feedback or near-term feedback for field faculty, et cetera, but it really is built on how much time we spend on a taxonomy, so people aren't wasting time with different things and we have to put it together. Is that a fair reframing? Okay.
Great. Well, yes.
I'm just thinking through this initially and wondering if we have sort of a strategic umbrella that we're functioning under in terms of how we adapt this database to meet needs. So, for instance, if we're concerned about infant mortality in the state, we could strategically really seek out all of those data that might contribute to maternal child health, and build a database that way. Or are we just being generalists here and, anything that we think we could possibly need in the future?
We need to prioritize what are the main issues. I think that some things that CARES is not just a data repository. The data that we've collected over the years is really based on the projects and the issues we've needed to address. So prioritization of what data is needed. So generalist on one sense, so we get the overarching framework, so it's easy to communicate to multiple audiences, but being very specific around what I believe the team will be getting into is what are hubs? What are these contained areas around issues that we can delve deep into? Data collection processes, visualization processes, communications into what audiences. So it's both. This is a big thing, guys. We're focusing on All Things Missouri, but it draws off our CARES engagement network website. We have the engagement portal. We have a number of tools. What we don't want to do is overwhelm, but to kind of help also get you a sense of all the different possibilities. To your point, that is very possible to be both. Did I help answer your question on that front or not? If you please.
Yeah. So sort of. I'm just wondering if we should, have a discussion as a group of what we see in Missouri health and safety priorities are, and then that would help drive and maybe that's what you already discussed, I'm not sure, but that's where my mind was going when we talked about that.
Yeah, I think part of that discussion is kind of around use cases. So who who is going to be using the platform and for what end.
Yeah.
And once we establish that, then we can determine what the priority issues and data sets are. And it is an organic process, so we don't have those answers right now necessarily. I know we have some idea that we would like this platform to support the new community engagement specialist role in some way. But if there are strategic initiatives in infant mortality, in opioid crisis, where we can supply the data and tools to help folks address that and make decisions around that, then I think that's all on the table.
Yeah, and yes, we need to prioritize, and it is issue-based. But you're going to see through this effort here, there's probably going to be some spin-offs of activities that may not be covered under the domain of All Things Missouri. Rather,
Right.
It's a very specific application or build. We'll try to capture all that and see what falls within the build,
Right.
beginning January 19 onward. Or is it through another funding mechanism that can be built out?
Okay, perfect. So I was going to turn it over to Jamie here and let her drive the demonstration. Sorry, pro demo.
Don't jinx me right from the get-go. So, okay, let me escape out of here.
Oh, before Margot and did I see Emily join as well?
Yes. Uh-huh.
Did you all have any questions to add?
I don't know.
Okay, great.
Hi, this is Emily. I joined a few minutes late, so I think I came in right after your introduction presentation, so I'm just catching up here.
Okay, great. Just let us know if you have you been able to see the PowerPoint so far? I had a little trouble displaying.
You can stop share the full desktop so you can navigate between models. So then go ahead and do share again with Zoom. And then do the whole screen, yeah. Was that how it was before?
Yeah.
I wonder what, they're not able to see?
For some reason, when you switch to presentation mode,
It lags.
yeah, it does.
That's
So,
weird, okay.
yeah, I don't know. We can talk about in our usability. How well do you like Zoom? Okay. We'll save that for another day. So this is the All Things Missouri site as we know it. So allthingsmissouri.org, it's live. You're welcome to visit it afterwards. I know you guys are going to be super pumped and you're going to spend the rest of your day on it. So, but this is the current iteration. So just keep in mind as we go through this is what we originally built. But again, we're looking to all of you to say, what can we do better? What can we do different? How can we make it more useful?
The menu on the right.
To go away. Yeah, I can.
Okay.
Yeah, I can move it over here. Okay. So it's broken out into three main sections. We're looking at maps, reports, and then basically external tools and resources. Over here on the left-hand side, you'll see this is where you can get to the full navigation. So you can see some of the sub-navigation items here. Another thing that's important to keep in mind is that just like these impact teams, we have used the 4 impact areas to organize content on the site. So while we are the health and safety impact team here, there are other, other components that are related to business and community, youth and family, and agriculture. So just starting here on the home page, as I mentioned, maps, reports, and tools and resources. If you click any of these, they're going to scroll you down the page and get you into that specific area. So here, starting in maps, the first item is probably the most visited item currently on the site, which is our Missouri Map Room. If any of you have used our tools in the past, you're probably familiar with the Map Room. This is where we house over 20,000 data layers available for you to map. I'll go into a short demonstration of that, but we'll get through the home page here first. The other thing that we've done is we've created some starter maps. And so what we realize as folks who are somewhat GIS experts, some more than others, right, is that you all aren't necessarily experts in geographic information systems. And sometimes you really need to be, have a good starting point, right? So we created some of these starter maps with layers already preloaded, things that might be of interest to you. to really help you or others who aren't familiar with the system get started. So you can click into any of these and they'll open in the map room, and then you're able to navigate around, you're able to find different locations and get more information. We're on the Wi-Fi up here, so I'm just gonna tell you guys right now that it's gonna be a little bit slow. And I'll try to do my best to talk through all this loading time. So, but you can see here, for example, this one's around opioids. So we have, for example, locations of mental health treatment facilities, substance abuse treatment facilities, and then our underlying data is around opioid drug claims. So here you could zoom into different locations and kind of see what the landscape looks like in terms of treatment availability and also possibly the claim rate as well. So going back to the homepage, you can see here again, we've broken out these starter maps based on each of the 4 impact areas. So hopefully there's something a little bit here for everyone. Continuing down the page, then we also have created 4 separate reports. Again, these reports align with the 4 impact areas. With the warehouse of database or the data that we have, we've tried to select data that we feel would be most relevant to each of these impact areas. Again, though, we are not experts in what you guys do or what would be useful to you. So really, these are just a starting point, and we're looking to you for guidance on those. We'll go through here. Let me find the health and safety report, and I can show you a little bit how this works. So first and foremost, you have to select your report area. So you may serve 1 county, you may serve 5 counties, or you may serve an entire region. And so we wanted to have the flexibility of allowing you to select any of those geographies. So here you can see I can select a couple of counties that I'm interested in. Here I could select just 1 county, or we have preloaded the extension regions in here. So you can select an entire region, which would encompass all of the counties included in that region.
Those correspond with the state region, the regional setup of the state health department and the highway patrol?
They don't, but I was going to add, so that's something that we could build in. So right now we have counties and extension regions. For other projects, we work a lot with hospitals and health associations. We have a lot of hospital service area based reports. So the ability to define regions and have them pre-populated for the platform is pretty flexible. If there are specific areas that y'all work in that are not listed there, then we could definitely consider those.
Yeah, especially those specific to health and safety, right? Because I know some of the requests that we've had, for example, from the business and community folks has been like economic development districts. That wouldn't probably mean a lot to you, but it means a lot to them, so vice versa. So here I've selected 2 counties that I know are close to one another just for demonstration purposes. And this is really where we get into the indicators themselves. So you can see here that we've selected some base indicators and created a taxonomy, right? So vulnerable populations, clinical care. Is that better? Yeah. Okay. So you can see here that you can select an entire data category. So we could select all of these indicators included, or we could select individual indicators and have them produce data for our report. The other thing that's important to note here is that there's these little eye buttons next to each indicator. And so what this allows you to do is find out more information, so the data attributes. So looking at, you have a nice little inset map that tells you a little bit about it. Are there additional breakouts by population groups? So anytime we can break out by race, age, gender, or ethnicity, we try to do so. And then there's a link back to the original source. So if you want to get deeper into the methodology and learn more about the data collection and reporting, you can do that there. So again, here you can select an entire category or just individual indicators themselves. So these are some of the things that we're going to be having you guys review and tell us whether you think they should be included or not included, why they are helpful or not helpful here. So I'll just go ahead and select a couple of categories, and then I'm going to go into click reports. So now we have a couple of output options. So the first output option is our comprehensive report, which is going to give you the most information based on the indicators that you've selected. We do have a breakout for each county, so if you are looking to compare counties or to look at a region and separate county information, you can do that very easily. We do show data by population groups, as I mentioned, and then you have the option to turn off maps. And that's nice if you're planning to print this report because black and white maps don't tell a very good story, right? So we also have a quick facts report, which just gives us some data tables. We're able to export this to Excel, so if you wanted to do some additional analysis in a different program, you could do that very easily. And then we've broken out all the source and methodology information into an appendix. In our old reporting systems, we used to include it in every page, and it made the report very long. So that was intentional to try to shorten it up a little bit. So as I open the report, it's going to start to populate each of those indicators that I've selected. And just to give you a brief overview of what's included in some of these reports. So you have the indicator name here. So we see population and poverty. It tells us, this STEM sentence tells us a little bit about the specific geography that we've selected in relation to the indicator. So you can see how many people within this area are living below the federal poverty level. We have a nice data table that shows us the report location. So this is an aggregate of the 2 counties that we've selected. So it pre-aggregates that data for you. And then it breaks out each of the counties that we've selected. So you can do a little bit of analysis here. You can say, oh, it looks like Boone County has a larger population living in poverty than Callaway. So if we were to do some programming or spend some dollars, we would have wanted to focus on that area over another, right? It does benchmark it then also to the state of Missouri and to the rest of the United States. So you can do some additional comparison there. And you can see it represented here in a dial on the right-hand side that is also interactive. So you can turn those things on and off and see those benchmarks as they are. Anytime we can provide a map of this, we do, and it is viewable. Let's see if I can do this correctly. In our map room, so it'll open up as a large map in the map room. But you can see it here. One thing to note is the data that's included in this table is reported at a county level, but anytime we can show it at a smaller geography, so this is, for example, the map is shown by track, we will do that because it's going to be most likely more meaningful for your work, right? Again, these are our gender, age, race, and ethnicity breakouts. You can see those here, and those also include some interactive bar charts and line graphs when available if we have change over time. So you can see it goes through each of the indicators we've selected. We've included this hamburger menu here at the bottom, so you're able to jump between any of the indicators that you've selected for your report. So for example, we had talked a little bit about infant mortality earlier, so you can see here we have that as one of the indicators in the health and safety report. You can see the report location, again, is an aggregate of those 2 counties. Then the breakout for each Boone and Callaway, Missouri, and the rest of the United States. You can see here, this one looks like we have some information also by race and ethnicity there. This is an example of that same data set that we looked at earlier, broken out then in the map room. So you're able to click and interact here as well. So that's just a really quick overview then of the report. Most of our reporting elements, like I said, the data table, the dials, the maps, and the charts, we try to make consistent across all indicators when available. And, you know, obviously when we can show things like change over time, we're going to do that, but we do have limitations. So anytime you're thinking about, as we're moving forward, incorporating additional data sets, those are some of the elements that you can imagine being able to view within a reporting environment for those. So you can download this as a PDF. You can share it very easily as through an email or on social media, print, or again, export it to Excel so you can do additional analysis if you're interested. So I'm going to go back to the home page here, and you'll see that there we looked at just specifically that health and safety report. We do have 3 other reports specific to those other impact areas. There are some overlapping indicators, and we fully expect that there will be overlapping indicators. So that's another thing to keep in mind, is if you don't find it maybe in the health and safety report, could you find it in a different report, right? Something like that. At the bottom here, then, we do have links to tools and resources. I say external because they will take you off-site. They'll take you outside of All Things Missouri, except for the crosswalk tool. But some of them are things that we've built, and some of them are links to additional resources. So you can see here, we do have this community crosswalk tool. As Angela mentioned, it's one of the new items that we developed. It's a little bit more focused on providing some context and information to the legislatures, but I think it can be useful in other ways.
It came out actually from a legislative group session we had. They said, you know, it would be great if, and we took the information from them, the feedback, and this is the tool that was created. This is just version 1.0.
Yeah. So here you can select either a county, a school district, a Senate district, House district, or congressional district. So here I'll just go ahead and select the state Senate district and click view data. And so what this crosswalk tool does is it really shows us the intersections of jurisdictions. And so we're looking here at state Senate District 6. So what counties are included in that Senate district? We can see here that there are 7 counties and it highlights them here in this map. It also gives us some additional information like who the county commissioner is and where the MU extension office is, those types of things. It tells us the area of your community within this county, so it gives you a little bit of context of how much does, you know, how much of my county is included in Senate District X versus Y, that sort of thing. As you scroll down, you can see here we also have school districts. So there are 28 school districts within Senate District 6. You can get the name of the school district, the enrollment number, and again, that percentage of the school districts that's within that Senate district. We imagine this could be helpful if you're doing any sort of advocacy work or you work with groups that do advocacy. You can say, you know, 5% or 50% of the students that live in your district go to this school or whatever it may be. Then we have the overlap of state House districts with Senate districts. So you can see you may be, you know, you may have cross lines there in terms of representation between Senate and House districts. And then also the congressional districts. And I think that's, oh, and the extension regions there.
So this is another area where something like health regions or economic development regions could come into play. We have included some contact information. We also talked about, you know, potentially including some assets like hospitals and school locations instead of just school districts. As you mentioned, this is kind of version 1, but there's definitely opportunity for expanding how this tool functions.
And I know probably the team here at CARES is going to say, Chris, don't come to future meetings. But the main point is, this is open. Everything that we're building, everything we're showing you here is open to change, to evolve, to get better in terms of more granular data or state level data, et cetera. So these aren't fixed products. They're going to continue to improve. This one is just clearly, we just got this out of the gate very quickly. There's a lot of improvement we can do on this. So I just wanted to just double down on that.
Could y'all be doing a presentation at the Extension Summit?
We are doing one for the pre-conference for the CESs. I don't think that we have one.
There are 3 present. I'm doing one presentation with Marshall and Blake. You all are doing one with the county engagement specialist. And I believe there's one other thing that's going on or not?
Maybe, question mark?
So, yes.
So I'm, Susan Reno has me on the research panel. And when I attended last year, I was just kind of blown away by all the research questions that the extension workers had. And it was the way they framed it though was, you know, these are the things we're interested in. You know, university, I mean, kind of paraphrasing, university professors have these different kinds of questions. And we need to bring them together and validate the validity of both. And the CARES database can be the tool to do that.
And I believe that's what Melissa and Shane Ting are going to talk about further is what are the research questions coming from the field, for example? How is it captured internally? We have to log in with your paw print. And it is that crosswalk between here are the issues or concerns or research questions we have and how can faculty help address those? So that's stay tuned.
So just some things to keep in mind, as I mentioned with the crosswalk tools, there are, you know, fire districts, public health districts, those types of things that you feel would be useful to kind of see where those intersections lie. Those are, again, the kinds of things, the kind of feedback that we're looking for from you all. So here, going back to the home page again, we'll just scroll down to this tools and resources section. So again, we have a link to the impact portal. the Explormo Health tool, which is, again, it's an external resource, but something that we think that you would find useful. Same with SNAP-Ed, Presidential Engagement
I
Phone.
apologize. That Explormo Health is zip code level health rankings. So we're the first state in the country to get down to zip code level. There's things that need to be improved on that. So I just wanted to frame that.
So we imagine that this tools and resources section, again, will grow and expand based on the feedback that you give us on what else might be helpful to put there or to drive people to. Finally, we do have some light information around each of the impact areas. We have just a few topics that we've broken out and done a little bit more research and provided some more kind of data stories around.
So to interject just a little bit here, so this is, I mentioned, one of the purposes of All Things Missouri was to provide some continuity from our quantitative needs assessment, and this is really where that is living out. So for the quantitative needs assessment, we put together 4 to 5 issues across each of the impact areas. I think there were 3 at the time, but we spread them out across made them fit to these 4 areas, where we did provide a kind of a deeper dive into some of these priority issues facing the state. Some of the issues that we selected were based on the qualitative discussions, and some came from internal discussions at some of the internal stakeholder meetings.
If you could click on opioids for a second, because I know some of us around the room are really keen on that. So if you just scroll down quickly, it's really a digital storytelling framing around the opioid crisis with visuals, but also the needed content expertise. CARES, what we're moving away from is not providing the stories. That's not what we're good at. We're good at the data visualizations, the framing, the visualizations part, but we really need to work with university faculty and field faculty on the content expertise that's needed to round it out. That's not our job. That's another opportunity of how we could work together.
All right, so just a few more minutes, and I'm going to go through the map room for you guys just really quickly, in case you haven't had any experience with the map room. So
maybe after we'll do that, we can take a 5-minute break or something.
I think that sounds like a plan. So here we're entering the Missouri map room. So it is labeled the Missouri map room, but you can see data nationally. So just as an FYI, any of this, it's going to pre-load always to Missouri, but you're welcome to zoom over to Iowa or Nevada and see what's going on there. So here we do have a taxonomy based again on the 4 impact areas, and then we also have some additional information around social determinants. So you can find data just by clicking through these carrots and finding individual data layers that you can add to a map. You can do that again easily by clicking the checkbox next to the layer. And we do have, again, these I buttons, information buttons next to each layer that tells you a little bit more about that layer in particular. I personally, let's see here, when I go to add data, I always like to search by keyword. And so we've done a really cool thing here, hopefully, where it starts to use some predictive text to tell you, oh, are you looking for this or that? So you can choose from one of these predictions, or you can hit the search button, and it's going to give you the full list of data related to that search topic here. So here we can see we have about 300 different layers related to poverty. So you can select any of these to add to your map. So I'll go ahead and just select this one, population below poverty. You can over here filter either by best match or release date. So again, if you want to pull the most recent data to the top, you would use that release date filter. So I will have this add to the map. It's a county level layer right now. We're looking at percent population below the poverty level. Over here on the right-hand side is where you'll see the legend, and you're able to kind of interact and manipulate the data on the map. So here I can select that I actually want to see this at a tract level, which is a smaller geography, to get a little bit more granular information. I could also see totals rather than percent if I were interested in doing that. So somebody tell me where to go. Is there a location that you're from here in Missouri?
No, I'm not. But you can go to infant mortality.
I'll do that here in just one second.
All right.
So, we will pick a location, Dent County. Okay, so here I can start to type in, again, it's gonna try to predict where I'm going. So I'm gonna go ahead and zoom into Dent County, Missouri. You can see the outline here. I'm gonna zoom out just so we have a little bit of context of where we are in the state. I can quickly add some county names, again, so we have a little bit better idea of where we are. And I can click anywhere on the map then and get all the information around that specific indicator in that location. So here you can see we're in Dent County. It tells you the census tract name. It tells you the percent and the total, and it gives you also margins of error for this data set in particular. So you can get that information very quickly. If I go back to that Add Data button up here on the left-hand side, I can type in something like infant mortality, and it should pull up the data that we have around infant mortality, and we can, again, add that to the map. So here we're looking at 2 polygon levels, so we might want to either toggle between them, you know, to be able to see both layers at one time, but you are able to view them layered on top of one another here.
Do we have the split screen on this yet or not?
Split screen isn't.
We have a swipe
here,
layer.
but we have the swipe.
We have the swipe layer here, so you can see both at the same time. In addition, we do have some additional tools or advanced mapping tools that you can use. So you could query the data. You could say, I want to see rates of poverty that are only higher than 80%. You could select or measure areas. You can use this mask tool. This is nice if you're doing presentations and you want to just highlight a couple of counties that you're working in. It makes for a better map in the PowerPoint. There we go. That sort of thing. And we also have then that swipe layer and walk scores. So that's just a really brief overview. Again, you can share or export these maps. You can share via email or social media. You can export them either as a PDF or a PNG file, so you can either drop them into a PowerPoint presentation, grant application, whatever it may be that you think where it would be useful. So that's just a real quick overview of the map room. Does anybody have any questions or want to see anything else here before we take a few minutes?
I do want to add, so the Missouri map room is actually a subset of the 20,000 or so CARES national public data. The Missouri map room, because one of our some feedback that we hear fairly often is, you know, there are 300 map layers around poverty. How do I pick which one is most relevant? So we did kind of tailor the list to reflect either the most current or the most significant data layers. So as part of the kind of data list homework, I will probably want to share with you all both what's in the Missouri map room as well as kind of our national public secondary data list engine. And then we also have a list of data for our reports. So the reporting environment has something like, I don't know, maybe 300 different indicators that we can select from. But basically anything that you see in the map room has a potential to be added to that reporting environment as well.
And that's so important when we talk about state level data, adding that.
Mm-hmm.
But our team needing to work through and with you all through the UX process, I just want to look at state level data because national secondary data may not be as actionable as some of the state level data we may be acquiring. So being able to navigate between national, state, and local and regional, we've got to work through that.
Yeah, and we've had conversations about this too. So how do we best drive people to the information that they want and not overload them with everything, but then at the same time, there might be those users who want to be able to see poverty across 2 different data sets across 10 different years, or for, you know, different subsets of the population, for children, for, you know, the Hispanic population, et cetera. So do we, you know, is less more or is more, and how do we make that distinction?
Let me ask you, because some of the criticism we've had in the past from Extension in particular was the complexity of the map room.
Mm-hmm.
It was hard to get to what we need, and I didn't know if you were going to show a simple leaflet map like of Colorado, is how might we lift out some of the data so it's really easy to navigate rather than going through the colossal machine here. I mean, this is the underpinning, but what can we lift out? And I think that's a question. So I'm not minding the UX process, am I, Melissa? But but there's different ways to visualize, and one of them, we got the reporting.
Yeah.
This is the map room, but there's also the very light leaflet mapping approach.
I'm trying to pull one up. Just keep talking.
Yeah, it's the, for example, Colorado Food Policy Network. It's for folks who just want to have 2 to 3 or 4 data layers that they can really work with and yeah, show off. So I don't know if you're there yet. So the Food Policy Network there.
So this is an example of one of those projects that we work with outside of Missouri. So this is from Colorado. But you can see here that they've created a taxonomy of all the different types of food projects that they're working on across the state. And so you can filter those on and off. But if you click into any of these, this is a kind of a more fun way to view information of like who's doing what, where, what's going on. You can click in and get some more information about the project. And again, as Chris mentioned, it's just a lighter map. There's less you can do, but you can still get a lot of information just by being able to kind of click through and see what's going on. So with that, we'll just, it's 11 o'clock, so we want to come back here at like 11:05, 11:10.
Take 5-10 minutes. We've got, again, fruit, bagels, coffee, water, and then there are restroom breaks.
We're going to stop talking to you, and you guys are going to talk to us when you come back. So.
Yeah, I don't know. Well, I was in like, they know, but I recently been kind of well, okay, because it takes a lot more to add data to a report environment than it's a little bigger.
Where was the source spot?
Right. So, yeah, okay.
Yeah, I don't know. So for the All Things Missouri report, we have, I shared it.
An hourly rate for.
For the map room, that's where you get about like 20,000. Well, sort of, but then no, I don't think so. But that would cut across the different geography types as well. So you saw the poverty that people was available at the county level.
Yeah,
that's
oh, do you? Wow.
Yeah, well,
okay. I think this is, so there is an immunization registry. I don't know how. Anyway, it's not on county route. All the time I tell people, well, people are very like, I do that. The shorter commute is much nicer now. I'm enjoying that a lot.
Yeah, I mean, what we need is.
You're my guy this afternoon.
Right.
All right, like it's doing.
Because we have.
find this like different.
We need to just have a
projects,
crosstalk with the
people,
client.
because right now we're trying to do one that we can for everyone.
Everything we can do to reduce.
Yeah.
I was getting my dad, of course, there's nothing like waiting for last minute, and in my new
And I think
office,
there's so many,
internet is
so much opportunity.
so, try to get reporting done. Finally, I after 14 hours a day on, I gave up and went home.
Went home to do it, yeah.
Oh,
And I thought like,
the process that already takes so much time and I felt like it was a dial-up. I was slow
over the next few days. So,
I think Kelsey is working on like, there's this portal
hitting our.
where you guys wouldn't have the internet. Like,
Yeah.
that
Not too far.
could generate. Yeah.
Especially if we could have one
I
page
should have like spent more time.
that you enter in.
I really did.
I had 8 sessions, because I like to do my pre and post in separate sessions. And open that up.
I was gonna send this
That's way down.
So I think we got him started on people. I don't know.
Very good, very good, yeah.
Working on stuff like half a day. So it's not really enough time to do anything, but that'll be great though. Yeah, I'm glad that someone else is getting their eyes on it.
Yeah.
Well, I'm gonna grab it.
Yeah. You know who I was thinking about in all this? She was really big at it, and she had like showing things. And, you know, where like your berries are high sensitivity rates.
Kelsey's gonna try to be there both days, I can only be there Monday. So get an idea what's going on.
There aren't very many of us being trained now, will the rest, is that gonna be?
There'll be other ones, yeah. Monday, Tuesday, right?
Do you think we'll ever get like a chair yoga program? Oh,
Someone let us enable editing. I had to type in the use case now, so I figured
I know a
out.
lot of people have been able to keep your yoga for a long time.
Okay, so you just wanna keep up. Yeah, well, I've been at CARES at the center for 6 or 7 years, but I started in like a very, menial role as, data entry operator too. But yeah, so I've grown here quite a bit, yeah.
It will be.
That would be fantastic.
Yeah, that way, well, you can pull up these questions on this screen and I can pull up, you can do, here, I'll share my screen and you can do side by side.
Minnesota came back and just said, thanks. She's
Colorado.
gonna talk to executive director and then.
Just being out there, I mean, it's so easy to have that. I need to find that sharing environment. I love to have more PSC work that is all getting trails made or, you know, bike paths or things like that.
And then you can press escape and do like side by side if you want, share my screen and the questions from your, you know what I'm saying?
And then do.
I hope this guy.
So I'm with Sam.
I've been telling people to we provide, you know, with their interest and.
If you just want to make that smaller and then pull it, the two screens,
Oh, right.
you know, that's, yeah. Okay,
So it's one of those skills that we really adapt and overcome.
Yeah.
But a lot of our folks are
Yeah. Well, and of course, you know, some communities might be more.
Right.
You know, I used to work with a corporate wellness program, our fire and Joe. Oh, and we had taught offered type data.
Yeah.
They were going to pick up on every single class back. Yeah. It was all I don't know. I mean, part of it's having a good teacher, but then it's relaxing and meditative. I've never actually taken myself out walking it.
Yeah, and
no, I'm getting help. Yeah.
It sounds like we'll have a good
Yeah, I'm trying
not to. I'm a big laugh.
Oh, I'm going down Monday morning and then spending the night. I think it's 9. I think they want us there a little early. I think that it's me and Mary both in a hotel room, although something about having a slumber party. But I think it would be fantastic, but I haven't heard anything about that. Mary. Oh, Meredith Berry. Yes. She is still in Trenton.
Okay, we'll get started in about 1 or 2 more minutes here. All right, so as we promised, the next phase of our meeting today is going to be really about y'all's participation. So we want to know, after seeing what you've seen, what ways do you think that you could see the All Things Missouri platform, the data, the tools, helping in your line of work? So we want to talk through, maybe some specific scenarios in which the data, the reports, or tools could help you find information. We also, as we mentioned, want to talk about what data in particular would be most helpful to add to the platform. That's really one of our major tasks. One of the major things that we're tasked with over the next couple of months is finding those state-level data sets to add to the platform. And then we want to know how would you share that information with others? Is it going to be through that direct share link? Is it going to be through PowerPoint? Other things that we haven't thought of. And then this kind of gets back to those use cases and scenarios at work. What will be the desired outcomes of sharing that information? Is it to, further research? Is it to do advocacy for communities? Is it going to be to make a presentation to community leaders? What are those outcomes? we're gonna maybe take some notes while we have these discussions. I'm not, unfortunately, able to edit this particular PowerPoint here, but we can do some, hopefully be able to share that information while we're talking.
It doesn't work to make PowerPoint the full presentation mode.
Yeah.
It's not set to record.
It wasn't working. I wasn't letting me edit while we're recording. So with those questions in mind,
In Zoom, you can insert a text box and edit in
Oh.
there. So on the bottom, there's a way to do that. It's under annotate. So when the menu pops up, there's the annotate, and then you just put a text box in there and sort of overwrite your. But we'll need to preserve those in another way.
Yeah, I think I can type in here, you guys will be able to see it, yeah. So
Okay.
we'll be able to capture it that way. Thank you.
Next time.
Yep. Not everybody at once.
So repeat the question, we cannot read the screen at all out here.
Oh.
Make them a little bigger, as big as it can get on.
Okay.
So,
Up the font size.
So the scenario questions are, what's the use case in your current line of work where you might see the current All Things Missouri tools being useful, and then as a kind of a side question to that, two side questions would be what data would be most useful. That's either something maybe you've seen today or you haven't seen, and how is information sharing? What mechanism of information sharing would be most amenable to that scenario?
I think, like I said earlier, if we had program data from our programs,
Mhm.
right? I kind of mentioned one, stay strong, stay healthy.
Right.
This would be fantastic, right? Because we could use all those different layers to see the impact of the program and where it was taught over time and those types of things. How we would use it would be all the things that you mentioned, Angela. I think, funding purposes,
Mhm.
for reporting, for presentations.
Showing our work to our community
Yeah.
too. I mean, I know where I'm at. I was actually just having this conversation with one of my MPAs yesterday about how we can, we're supported in the community, with commissioners, councils, they're all very supportive, but they highly value the ag portion of extension and
Right.
not so much the other stuff. But my MPA kind of feels like she's treated like, oh, well, that's nice what you're doing, you
Yeah.
know, but really we're interested in the economic impact that these ag programs have on our bottom line. And it would be great if we could put, our program data in there and overlap it with trends over time and look at the impact we're having on childhood obesity, or look at the impact that we're having on, whether it's seniors. I don't know if there's something about, but yeah, seniors being able to stay independent versus being in the hospital or being in nursing home. But making it to where they can see kind of the bottom line impact that we're having in the community.
Yeah.
Putting it a little closer to a little more dollars and cents types of impact.
Right.
I think that's what some of them really focus on.
So that's primary data collection and reporting, and
Right.
you also mentioned some ties to other kind of community level data,
Right, being able to look at those
obesity,
trends.
some
and-
senior independent type information. Are there other metrics specifically that you'd be wanting to track outcomes for that are not?
Fruit and vegetable intake, force weight.
Mhm.
I would love to see, I used to work in a corporate wellness program where we did health screenings every year, and we
Mhm.
looked at, who's most involved in our programming and how has their blood pressure changed, how's their cholesterol, how's their insurance claims. I don't know what all is available on there.
Right.
But it was nice to be able to, of course, correlation is not causation, but you could at least show, the more active people are in our program, the lower their insurance claims are, or the lower, we're seeing people come off medication. Trends change time, and it'd be great to be able to show that
Right.
to our stakeholders in our communities and at the state level as far as our legislators.
Okay. So in terms of the sharing use case, then how this kind of gets back to that point of we don't really know at CARES how you all work in the field now. Do you generally share via, and I know we're kind of moving ahead into other territories for other meetings, but Do you share via like PowerPoints or reports, or what's the main
PowerPoint
workflow?
reports, I would say, are the two biggest
Okay.
things. I mean, I'm new to the CES role. I haven't been a CPD in the past, so I'm kind of new to having to share these results, but
Yeah.
that's what I would foresee.
Great.
And I think more offline, we'd have to really get to the My Extension dimension of how you're actually putting in program data. What might be some crosswalk with that, or do we build that out and have those kind of conversations?
Right.
Because I suspect it may be a similar kind of thing across each of the impact areas.
So, most of the time when I'm looking at state health data, I either go to county rankings, or if I really want to go into detail, I go get into MICA, which I can them now. You guys are familiar with.
Yeah. Yeah.
So those are set up, number one, based on, what data is conveniently able to put in there.
Right.
And number two, like county ranking sort of has a kind of overlying agenda in terms of what parameters you use to rank the county's health. So those are in there, but I'm thinking of where the gaps are. And as I think about where the gaps are, it occurs to me that the gaps may be resulting from political bias. So I'm wondering if that's sort of a niche area, if we have the fortitude to tackle. So, for instance, St. Louis has the highest rate of violent crime in the country, hands down. And we don't have a lot of data about that. And, there's some in MICA and stuff, but like in terms of mapping it and mapping gun retailers and, all of the things that would go into like a similar model for like establishing a food desert or something. That's a research gap. And same with the other one we were thinking of, we have a colleague that's in this area. We're interested in infant mortality, but in terms of mapping family planning services, access to contraceptives, and there's some serious family planning deserts out there that no one has established. And so, and I don't know that the state will ever tackle those because it's too hard. So I'm not going to throw that out there.
Yeah.
See what the room thinks. But I think that these are important neglected research areas.
So this would be a research area, maybe like a preliminary assessment would be a use case?
Yeah,
Okay.
We know a faculty member that's actually researching family planning thing. I know she would be pleased.
Okay.
I don't know who on campus is looking to come to violence, those types of data that maybe someone should use.
Yeah. And in terms of a pathway then, so you're mentioning that research that's already ongoing, would you imagine that we would, have collaborations or a collaboration pathway to work with researchers to then, share this information? Or would we be the primary data, collectors, and then researchers would go to us to access it? I mean, how would that, just throwing a couple questions out there.
You all are the denominators, and then the whatever research project is going to be the numerator. So they do an intervention, and they look at the effect size, and then the constant though could be another geographic region or a similar region. So you all continually provide the denominator for those research projects. So I mean, a vector would be starting with research projects. I mean, if faculty are already doing research, you never hear a faculty member say, "I have too much data." They never, ever say that.
Right.
The next thing they say is, I don't have access to this other data.
Right.
You all have access, or you know how to get access, and you can make that access happen. So there needs to be that, when Chris, when you're saying, is there too much? There can't be too much.
Right.
There can never be too much. There can oftentimes be not the data I need to answer my question. So then you start with the question. So the priority for your data then has to come with, based on the President Choi's vision that he laid out last Friday is, you know, research, and research, followed by some more research. And so faculty, I mean, we feel, you know, our feet are to the fire in terms of the units that are going to get funding are the ones that are going to be doing the research. And sometimes they don't ask those questions because they don't think they have access to the data, or they don't know this data is out there.
Right.
So, and then thinking beyond so the money is the next thing that ties it together. So having dialogue with extension specialists, folks on campus, but that's part of the extension summit is having, I think everybody come to Jesse Hall that one day. I mean, you need to be like on stage saying, and we need to have these dialogues between the extension specialists and the researchers, and you all provide the data to make the conversation happen. And that will drive it because the researchers are saying, well, you know, there's like PCORI funding for patient-centered outcomes research. And it's like, you know, 75, 90% of it goes to urban areas. And because people don't have access to rural data. Well, you all have it, 10 to 20,000 layers or so. And that'll do things. So in my last comment was getting back, is there too much data? I mean, we're, you know, $200+ million going into the TPMC, you know, for precision medicine. This is, when you're drilling down to census tract, I mean, you're talking about precision social health, you know, and you need to be marketing yourself as precision health, that because those people that are going to be served at the TPMC, they're going to come from someplace in Missouri, they're going to get their genes fixed, and they're going to go back someplace in Missouri, and it's almost like your fingers crossed, because you're hoping the social determinants of health don't undo whatever genetic intervention they did, you know, and so you all need to be at the table making that case.
Yeah. Yeah, and I think that's partially why we're hoping that this collaboration with extension folks working in communities and collecting data in communities is potentially so valuable for All Things Missouri. You know, you've talked about rural health data. We don't have a lot of community level rural health data beyond our work with Explore Mo Health and their zip code health rankings. A lot of data for rural communities is suppressed because there's not enough sample size, you know, so it's something that we struggle with.
Back to the taxonomy thing, and this is that other project that we've talked about before with Blake and Paul Foreman. And
The asthma.
Yeah, the asthma project, but it could be for any chronic disease management, and there's social determinant package, database package available for all electronic health records, whether it's Turner or blocking on the other names. They have social determinant health packages available for those electronic health records. A lot of times they're not turned on because the physicians say, well, there's nothing I can do about it, you know? And then maybe right next door you have an extension specialist who could do something about it. But you know that there's an issue because nobody's getting that data on the front end, especially in rural areas. But so that collaboration needs to go on. And I think we talked to Manny Hall about that, is getting those social determinant packages available in electronic health records to address that sample size issue. Because it will be gathered. I mean, with extension, you got all the health nurses, you have extension specialists. I mean, and you don't, if you have population level data, you don't need a sample. So.
Right.
I think where this conversation is going is we've got to balance the need for researchers never have enough data to how you're communicating what you do have in a way that is simple. And so that's our task, is being able to have APIs or working with researchers on one level, having that full loop around what are the research questions, what are the issues. For field faculty, it's not overwhelming field faculty and saying, you're just going to be a bunch of data collection people all the time. No, that's not it. Is how do we really get intentional around what are 2 or 3 attributes that we could collect? That is not a heavy lift, but no one else has the workforce across the state to do that. So those are all the things we're going to live out over the next 3 months, is how do we provide a platform that accommodates these different audiences.
They have an app interface version, so like when Steve's doing his project, he can just, or barcode it, and it goes to your
Right.
database?
Yeah.
Can you do that?
We've done things like that in the past. There's nothing that we have specific for All Things Missouri, but we can borrow from those to stand something up that supports that, if that's a desirable thing.
So we have a mobile, a responsive website that can collect data, but it's not from prime time now. But what we need is actually just a mobile app, whether it's an Android or iOS, that can get us just out the gate, something simple. And we're working on that. I'm in conversations with some groups about how we can do that. But I don't want to get ahead and be presumptuous. I'm looking at Melissa and Jane Ting, presumptuous on what you all need, but that mobile data collection tool could be quite powerful. That's part of the due diligence is the Qualtrics versus what we're doing with, can you geocode? Can you get the geo IDs? Can you get the images, the pictures, and the other things in a Qualtrics framework? That's the question.
There you go, that'll work. Because Qualtrics has a really sweet mobile interface.
Right, and that's what we use.
Yeah, we've had some initial conversations, because we did have a project with Joe Britt and the SNAP-Ed, doing, and had some kind of exploratory sessions with what they were doing for some of their program evaluation. But we didn't get to the point where we've got a Qualtrics, a system where Qualtrics is talking to our databases.
So that's very much an opportunity that we may on the list to explore. If that's the best way to collect that information, or a great way to collect that information.
So we've talked a lot about different population health aspects. Is there anything in terms of the community safety applications that you wanted to maybe chime in on? Sorry to put you on the spot.
No, you're quite right. And I've been trying to wrap my head around this and how this is applicable to us, specifically in the fire service. That's my area of expertise. And it's kind of hard because we haven't had something this robust available to us before. Whenever we have data needs, we have to really go out and harvest that data and procure it and correct, spend a lot of time in spreadsheets.
Yeah.
So it's hard to look at it. It's something we haven't had accessible to us before, but definitely with the mapping tool, just the jurisdiction is such a huge issue. In Boone County's fire services and statewide and nationally, but jurisdictions are such a huge issue. So being able to compare population data across different jurisdictions would be, I think, quite phenomenal, especially from legislative points of view. But right off the hat, I saw that as an accessible option, and that would be a phenomenal asset, I think.
Okay, well, that's good to know.
But I mean, there's a lot. I'm not for sure where the data sets would come from, and I've started making a list of data sets that I know of. But there are several implications that this could be huge, but it would have to take a little bit more sidebar exploration.
Yeah. So in terms of that community crosswalk tool that we kind of demonstrated, you see more applications for that than some of the other?
Right.
Okay.
Yeah. So I think we make in the fire service a lot of assumptions of who our population is.
Right.
And we get somewhat jaded because we're always running in the same areas with the same clientele and whatnot. So that becomes our perception of our community.
Sure.
So having something that's more rounded of data sets that we're not familiar with and give us more of that information that we don't know, I think can make our business case decisions more efficient.
Okay.
So I could definitely see this as something that could become a great resource, but just we haven't had access to this before.
Yeah. Well, that's great. Okay. Is there?
And everything you're seeing here is publicly available.
Right.
So that is out there. So just to underscore.
So in terms of like immediate, if we could have one data set or one jurisdiction to add to something like that crosswalk tool, would it be are there fire service districts that are, you've got GIS boundaries for that can be added?
And unfortunately, there's quite a bit of variety to those at the moment. Yeah. But yeah, just seeing where the fire departments and the fire districts and the unincorporated areas that don't have a fire service pertaining to them.
Okay.
Because I don't know of any resources, especially at the state level, that has those mocked up side by side. And so to be able to create that visual, I think would be pretty impactful.
Okay. Great. Well, we should talk. Send me an email.
Not a
Some of
problem.
that. Perfect. Okay. Anyone else have any use scenarios you can think of?
Another one, this is CES,
Yeah.
using it to look at needs, returning assessments. I mean, that's really obvious with this, to be able to target, with a little more precision, and just exactly what my community needs, whether it's from a health and nutrition standpoint, things that I can provide, or, you know, things that maybe they haven't even thought of, and ways, you know, I can look at, gosh, I don't even know right now, but other areas outside of my expertise, I can look and see what are our needs and how can I connect that with campus or with other specialists outside of my own.
So
Yeah.
that's to sort of set a community baseline, or maybe look at trends, or.
Both, yeah,
That's
either
like,
way,
just see what's going on now.
Yeah, what are our needs now, and then, you know, has it, yeah, I don't think the trend is something that's been a problem for a long time, or first, better, how are we already addressing it, you know, how can I bring in other outside resources,
And-
hopefully address it, and then over time, is this making sense?
And that's the conversation that'll be coming up in the summit with CES, County Engagement Specialists, is not needing to be an expert across all the four impact areas, but enough to be like the foyer of the house to direct people to where to go.
Right.
But again, it's that value added at ankle deep level, then it can get deeper as we position people the right way.
Sure, and being that so many of those areas I'm not an expert in, I don't know the right questions to ask. And so
Yeah.
by using this data, I can maybe be a little more informed about what the needs are, so then I can then go and talk to people in my community. Hey, you know, I know that the data says this. How do you feel about this situation? What can we do to help? And
Yeah.
maybe list some resources and work with them to address that issue.
So
I'm
that
not
would-
an expert in.
That would be a tool that would be beyond just a, you know, a health and safety needs
Right.
assessment or report, but something that brought in indicators or data across all those sectors, and then maybe even, you know, told you or spit out a list of the priorities
Right,
based
yeah.
on some
Yeah, that would
benchmarking.
be very helpful. Yeah.
Yeah.
And even resources and existing partnerships or
Mhm.
potential or suggested partnerships. Yeah, that would be great. Yeah, suggested partnerships, and then with a list of resources, because, I mean, I've been in extension about a year and a half now, and I still feel like I know about this much outside of my own specialty as far as what we can offer. So it would be nice to have that. And I know we're hiring so many new CESs that
Right.
I mean, they could be very easily overwhelmed. So to have that resource suggested partnership would be very.
Yeah. That's great.
Is that a data layer like all the agencies in the community?
I don't know that we have anything specifically around different agencies. We certainly have various versions of a lot of these jurisdictions, like your economic development jurisdictions, and then some of the contacts. But in terms of resources, we don't have anything in-house. Now, we have tapped into, what was the,
CARES
Amp-
database?
Or Aunt Bertha.
Actually, we
Bertha.
started tapping into that Aunt Bertha.
Mhm.
And
So some of these like 211 type resource lists, you know, we've worked with them via APIs in the past, so something like that could have applications if we're talking about what community resources exist to help with issues around things. And we could use a taxonomy like the AIRS taxonomy to identify what those needs or community issues are.
Right. I mean, that would be very valuable to work with CES if they have that.
And there are free resources like Aunt Bertha out there. There are also paid for access resources that I think that could be considered as well.
Right.
Yep, Bertha's free because she scraped the data from theirs. So,
So with AIRS, is that a researcher may love it, a county engagement specialist
no,
may
it's
not.
designed,
like it.
no, it's designed for community users.
Okay.
For citizens, it's designed for citizens.
Yeah.
The user interface sounds much better, but the users don't deal with the taxonomy. Information specialists deal with the taxonomy.
And
Yeah.
it's really important that you bring that up in terms of errors, because what we're doing is setting the stage for what actually ripples out to other states across the country. And using errors as a national framework, adopting it from Missouri first, is going to get more of a buy-in or more of people in tune with that potential. Is that a fair way to?
Absolutely. And there's another initiative out there we can talk about later that's doing the same thing, they're scraping the air state.
Is that out of Austin, Texas, that group?
Now, I'll say that
Okay.
later. But the community engagement specialist, though, I mean, it would be nice if the university took over AIRS for Missouri. I mean, right now, you've got Kansas City and St. Louis, and it's not real organized. But the community engagement specialist, in terms of, since they're there in their communities, could keep the AIRS database updated, because those are the community resources you need to use.
That might be, let's follow up on that in a separate conversation, learning more about how the University of Missouri could take over that kind of stewardship of that. That would be a great thing to follow up on.
Is it AIRS, AIRS?
Uh-huh.
Okay,
Yeah,
thank you.
there's the AIRS taxonomy. You all have your 10,000 layers, they got their 10,000 taxonomy.
Yes, they do.
Yeah.
Elements.
Mhm.
But it takes 10,000 to describe where we live. I mean, we live in a complex world, not.
Ada, in terms of the meeting we had earlier this week, on Monday, you're seeing applicability in terms of data or what can be added?
Yeah, the last time I was at Angela's office for the data that I needed for the baseline data. So today I saw something that was really very interesting, the claim data.
Yes.
Yeah, so that would be definitely something
I think that to that point, your comment about people have to continually get data and harvest it. How do we change the mindset of the need of not having to harvest because it exists elsewhere potentially? So that's going to take, I don't know the answer. Is that something that's prevalent from a field faculty perspective? Is that, or what is the modus operandi right now? Is just harvesting or what?
Large part it's harvesting, just because there's no really centralized repository available to us. And it's fire service as a whole is slowly embracing academia. We have folks with degrees and whatnot, but you know, for the majority of the state, there's no minimum requirement to be a firefighter. So there's no high school diploma required, no degree required, no. So the whole way that they treat data as a whole, you know, it's such an afterthought.
Yeah.
So it's trying to transition into that, hey, you know, don't reinvent the wheel. There's information in how to use data and whatnot. So having a graphical interface or something that they can learn, and it'll take a little bit of marketing and education, but having something we can point them to, I think would take very well.
I talked to Chris earlier in terms of marketing that other states is like being exceptional. So one of the conundrums in public health data right now is tracking the immunization rates and immunizations and exemptions in schools and putting that all together. And my overriding concern is that data drives problem prioritization. So if you don't have data, then you're not going to put it on your priority list. And so, for instance, HPV vaccination rates in the state are like essentially rural, but we only know that from the National Immunization Survey. I don't know how specific we are about school level stuff, but there's going to be a generation of kids that are going to wind up with cancer and kind of terrible cancer. So so somehow balancing what data is available and accessible with the caveat that the priorities are buried in there, or the data might not be very accessible. That doesn't mean that that's not a priority. And the other one is flu shots. You can get flu shots, Walgreens, Walmart. We have no idea who gets the flu shot, who doesn't, what's our flu shot rate, where, who's got the shot still and who doesn't, who ran out, I mean, all of that stuff. So I don't know if there's a way for you guys to, because you can only go with what you have.
Right.
Well, no, let's kind of change that thinking. To date, that's what we've been doing.
Mm-hmm.
Moving forward, we need to have two buckets. What data does not exist? How could we potentially acquire, I mean, the broader we, because it's not a CARES things only, but what are mechanisms to collect data that has not been collected previously? How heavy a lift of it? How much do we bump it? So that's a whole group in itself, is more, what do you call the data governance type framing around that?
Yeah, I mean, I think that'd be more like a, data gaps needs assessment more than, talking about.
I mean, that's kind of where I'm going. Is
Yeah.
So I think let's, is it available, is it accessible? That's great. That's our lowest hanging fruit. Is it there? Is it being collected, but it's not available? What do we need to do from an administrative standpoint to acquire that data? It may
like
be
your school immunization records. Someone has that, but it might not be something that's publicly available or, right.
And the third bucket is, for example, the conditions of playgrounds. It sounds like a little thing, but just because there's a playground on a map doesn't mean kids are actually exercising and on it, because it could be dilapidated, there could be drugs being sold around the playground. So what are the conditions? None of that's really collected. So it's little things like that, where are the gaps? Doesn't exist? Should we go for that? To your point on the immunization, and then all the secondary data that we can acquire.
We do have an immunization registry in the state, so nobody knows what's in there.
Right. Right.
Is there a comment on the phone? Do you guys want to chip in on that? What's that? Did you hang up on someone?
No, I'm getting another call. That's why I beat.
Oh, okay. For the folks on the phone, and as you've been listening, did you want to weigh in on any questions that Angela has raised?
No, I think I just have to echo kind of what my colleagues Steve and Sarah talked about, I think in the case number 1, using, this information for programs, for showing impact, to our county commissioners as well as our extension councils, I think. And of course, as I'll be or AMA CES, so as this role becomes a little, more into focus, what we, I think this is going to be a great platform that we can use for that as well.
Thank you.
So for that, would those extra resources be a priority as well, in addition to the kind of, getting a pulse needs assessment?
Yes, they would. And I think too, there was something mentioned about, using the specific zip code tool as well. And up here in our area, we have kind of some very extreme cultural diversity shifts. We have with some new, like a meat packing plant that came in. So I think just being able to see the difference between, 2 zip codes that are very close to one another is something that would be quite interesting.
Great.
I was thinking about I guess you would call it an interface between types of data. For example, with the opioid addiction, there's a lot of information there. But opioid addiction doesn't happen in isolation.
Right.
There's often, Lynelle has mentioned violence. There's also often, not necessarily somebody, I don't know, holding up a bank or something, or shooting somebody in the corner. It is interpersonal violence.
Yeah.
Happens. Child maltreatment. And so I would like to see some databases that may interact with or bump up against the opioid addiction, because there's a lot of other social situations that surround an addiction.
Right.
That enable the addiction to happen.
Yeah. So in your line of work, do you use, data to do needs assessments or things like that, like how would that data be used and accessed and useful to you? Just to think about, is a map the best option, or?
No, actually,
Yeah.
a map, I think, is a good option.
Mm-hmm.
But the way I see it, I also have to see those other factors that may interact
Right.
with the opioid addiction.
Yeah.
What other kind of drugs are out there besides the opioids?
Right.
Probably a lot of them. So that would be information to have. And so if I were to, I will use this, to get in and use it, I need to know the whole picture.
Mm-hmm.
Because just an opioid addiction is not the whole picture. That is.
Yeah. It's a symptom of underlying things.
Yeah.
Right.
So in our meeting the other day on Monday, they talked about an evidence-based research done on families and strength of family ties, et cetera, and as that relates. This is where the research can really inform what indicators we look at,
Mm-hmm.
and then what we can raise up from a mapping standpoint. So I guess it's going back from a research question and pulling from that report that might inform those other indicators you're talking about. I don't know.
Yeah, one thing that Jamie demonstrated was our current issue area. So we do have an issue around opioids right now, and we mentioned we want to get away from doing narrative content, but something like you're mentioning, having the social context and in maybe a dashboard form with other data that's related that could be informed by research or evidence might be a good window into that. So for a particular issue area, whether it's immunization or opioids or I don't know, police training or something like that, we could have an area with data based on evidence.
So, yeah, we're the lowest common denominator, right? Okay, so we're the denominator in terms of data and availability of data, acquiring data, et cetera. And the numerators are all the questions that are popping up. Is that it? Whether it's an issue, research question, et cetera. So we need to have an organic way to really have those pop up. Then what we need is a group that really decides on, well, what can we tackle? We can't be all things, even though it's all things Missouri. We can't be all things to everybody. What do we prioritize? Maybe that's another, I don't know how that might come up.
Yeah, so I think, so we have about 10 minutes left.
Mm-hmm.
So the last couple of things that we wanted to talk to you guys about is really the lead into next month's meeting and around kind of reviewing the data list that we currently have. So we have hard copies for you guys to be able to kind of look through, but we'll also send you online lists so you can also scroll it on your computer as well. And so really the next time we come back, we are going to talk even more about data, but we would love for you guys to come with specific ideas of things that would be helpful to you in your field, referring back to some of these use cases, thinking about ways that it could be used or it could enhance already or processes that you're already involved in or whatever it may be. So we had a couple of thoughts around, just thinking, are the data that you're interested in publicly available? If the answer to that is no, that's fine. We just want to know, are they easily captured through an API or downloaded? Is the source reputable? Are they updated on a regular basis? And kind of what geography are they available at? You don't have to answer all those questions, but it would just be helpful as we have conversations in the next meeting to know answers or to have an idea about whether, what the answers are to those, because I think it will ultimately help us, again, back to this priority conversation, give priority to certain things over others. So we'll hand out the data list here for you guys to have.
And so I should say the data list here is what's available in the health and safety report platform on All Things Missouri. We can send you a link to the data list in both the All Things Missouri map room as well as our public national map room for comparison. So if there's something in the national list that's not in the Missouri list that you'd like to see moved over, that's a very easy step.
So we'll follow up today with this list and then a full list that you can peruse. It's very long, so take it to bed. It'll put you right to sleep, right? we'll also, so we did record the session, not that you're gonna wanna watch it again, but if you did wanna share it with others, you're welcome to share it with others. There were a few people that were invited that weren't able to make it, so we're gonna send the recording and follow-up notes for you guys. And then really just our ask for you between now and the October meeting, again, is just to think of, to review these lists, to say this is good, this isn't good, this is what's missing, this is what we use, this is what we would like to see incorporated, and bring that back to be part of our conversation for next time.
Jamie, would you want to have them submit that, I think, advance to the meeting next time? If they coming up with a list of 100 new data sets to add, it might be good to know rather than discussing the meeting.
Yeah, I mean, if you could, but I don't think we were gonna require it.
We'll send out, we'll send out a reminder probably a week before the session, just so it's fresh on everyone's minds. And at that point, if you have, if you've got an Excel list that you're tracking and, wonderful, we'd love to have that. If you want to just come and bring those ideas to the discussion, that's fine as well. So it's kind of, again, this whole is it's an informal, organic process, but what you contribute is what we can, what we have to work with for our prioritization and our next build.
Any other thoughts or suggestions for us? By the way, as we should have mentioned at the start, you guys were the first impact team to come together to give the guinea pig. So any feedback on process, but also
What worked and what didn't work? So I guess for the question, this is a pretty long table, and I noticed that the screen was kind of small. What worked today and what didn't work, so we can take these into our next meetings? Anything?
I think some people were concerned about being able to read the screen. I can see it well enough. I was more interested in the mouse click, so I can get into this and actually poke around. So I don't know about the rest of y'all, but I wasn't so worried about the size of the.
great. But I was worried that I know what it's supposed to say.
Yeah. I forgot my glasses.
You got me to move up there, and I can sort of see it.
And that's actually the third time that I've seen a presentation on the circuit, which I'm every time I see it, I'm glad because I get reminders along the way, so that's not a complaint, but that helped me to, it wasn't as big of a deal that I could see, so I think the exposure.
Good job.
Yeah.
Very
informative.
Good job.
Since this is a relatively new platform, we don't have a lot of support materials up, so please reach out if you're going through this in the next week, the next month, and you're like, hey, I can't find a thing. Reach out to us. Let us know.
Are you all going to be doing the video tutorials that you did for the other one?
Y'all.
Yes. It's definitely on the list. So we just, we're, the one struggle that we have is if we are going to be changing the platform, we want to have more of a final version when we do the walkthrough. So the video doesn't look starkly different from what you're actually seeing on the screen. So
My students used it last spring.
Oh, yeah.
And they loved the video tutorial.
Oh, good. Awesome. Great.
You did a great job.
Oh. It's all of us. You might just hear my voice, which I apologize. It's not the best video voice. So, okay, perfect. Yeah. Well, thank you guys very much. And feel free to reach out to us. You have our emails and you know where we live now. Better work. Thank you guys. Yeah, thank you guys all for being here.
Thank you.
Dr. Emma, I'll send you an email.